Good morning, folks. Al Mattingly, Daviess County Judge Executive here, just starting our update on COVID. We have some special guests with us today, and I'll get to them pretty soon. As normally I do, I have my mask on to remind everybody how important it is to do those things that we used to be our only tools, which is wearing masks, socially distancing, avoiding large crowds, and washing our hands. Now we have another tool in our toolbox, which is the vaccine. And we're going to talk with some of our local pharmacists, some of the independents in Owensboro and Daviess County about the importance of the vaccine and how you would go about making appointments and things like that. But first, let me do an update on COVID cases in Daviess County. I'm sorry, I'm a little not quite ready because I had somebody else in my office just a minute ago. Just for your information, we had 17 new cases reported today. And that's a little up. We've seen Daviess County ticking upward for the last couple of weeks. We got down to, I think it was 10.2 cases per 100,000, which meant we were about to get into the yellow. And doggone it, we turned around and started back up. Next item, Jordan. So if you look, you'll see today, this was as of yesterday evening, Daviess County was at 13.5 cases per 100,000. If you look down at the bottom, you'll see the overall current incidence rate in the state Commonwealth of Kentucky is 10.3. For the longest time, we were below the Commonwealth's rate. Now we're back above it. You'll see that we have very few red counties left. Lyon County down there to the left, far western Kentucky, is at 26.1. Some of you may remember a couple of weeks ago when they had the outbreak at the Kentucky State Prison, they were at an incident rate of 600 cases per 100,000, but they're slowly coming back down. Really great news, Ballard, Carlisle, Hickman, and Robertson up in eastern Kentucky are at fewer than 1 cases per 100,000. So we're starting to see some green. Jordan, next one. Jordan, are you on there? There we go. This is cases by age range by month. And one of the things that I want you to kind of look at, and the colors are a little blocked, but one of the things that we've noticed here in the last few, there we go, in the last few weeks is that our incidence of cases during the 4 weeks of March, there were only 17 cases, new cases, in the Green River region for those who were 80 and above. So those who are 80 and above were some of the first to get the vaccine. So I think we can see where the vaccine is really working. As a matter of fact, for the first time, the 60 plus, those who are 60 years old and older, has the lowest percentage of new cases. Those under 20 making up 21% of the new cases. So it's the vaccine works, folks. And if you're eligible to get it, and everyone is going to be eligible here in, I think it's next week, you should really consider it. Looking at the vaccination rate, and this vaccination rate comes directly from the CDC COVID data tracker. You'll see that in our county, this is for Daviess County, we have 18,799 folks who are fully vaccinated. So they've either gotten the 1 shot from Johnson & Johnson or the 2 shots from Moderna or Pfizer. That equals 18.5% of our total population. But if you look at it, it equals 24.4% of those who are 18 years of age or older. And it actually equals 55.9% of those who are 65 and older. So 60, if I'm not mistaken, 60 and above made up almost 92% of those who died from COVID are as a result of COVID. So we're getting the people who are most vulnerable population vaccinated. That's a good thing. Jordan, you got anything else on there for me? This kind of shows the county by county, but you can find this. We'll go by this. You can find it on the CDC COVID data tracker. I think the last thing that we want to look at is the providers. And if you're looking for a provider, look up vaccinefinder.org and you will find it. And on there, you will see some of the names of the folks who are going to be with us today if we had all the pages. But I noticed that Nations Medicine is on there. I know Danhauer's is on there, and I'm sure Poole's is on there. Jordan, anything else? All right. So, folks, it's my pleasure to have some folks representing our local pharmacies. I have Carl Lewis with Nations Medicine out on Highway 54. Good morning, Carl.
Good morning, sir.
I have Martika Martin with Danhauer Drugs. Good morning, Martika.
Good morning.
And I have Ron Poole with Poole Pharmacy on. And those names I just listed, the pharmacies, they are well-known names. They have been in our community forever and a day. So let's just get right into some of the questions that I have. So prior to COVID, were your pharmacies doing other vaccines, Carl?
Yes, we actually have a vaccine clinic inside of our drugstore. So we've been doing flu vaccines for about 15 years now, along with meningitis, shingles, travel vaccines, Hep A and B, pretty much anything that people are needing, we're able to provide.
Okay, Martika, I'm assuming that Danhauer Pharmacy has been doing the same thing.
Yeah, we've been doing all of those vaccines and even being able to go out, especially during flu season, to different residential places and doing clinics there to help increase access.
And Ron, same with you, I would assume.
Yeah, 2007 was the first year pharmacists could get their certification, and we did that. And so we've been a spot, a resource for people to call in case they're traveling anywhere in the world to get their travel vaccines. We also have done school systems, so we'll do the entire school employees, whether it's teachers or custodians or anything. And while we do those, it's not just flu shots. We'll offer a vaccine day where people can look at, do they need the Pneumovax? Do they need Prevnar? Do they need Shingrix, meningitis, hepatitis? A lot of those things, have not been well known that pharmacies have done it, but we've also increased vaccination rates in Kentucky before COVID. Now, obviously, COVID has put us way back behind again, especially in the pediatric population. But yeah, we've been doing that since 2007.
So a lot of folks in the past, as I was growing up and became aware of vaccines and all those kinds of things, became apparent, a lot of folks would go to the health department to get vaccines. Do you guys also administer I forget, for diphtheria and measles, mumps, and chickenpox and those kinds of vaccines, Carl? Do you guys do that as well?
We do, yes, sir. Any vaccine that someone is needing now, we're able to provide. We work with their doctor. We verify, the need for the vaccine, and then we're able to take care of that.
So, and I'm assuming all the others do the same thing. Martika, so we're talking about a vaccine that not everybody. I mean, I got the vaccine the minute I was eligible. I hear a lot of conversation about these vaccines because they're so new, they were developed so quickly, and everybody on the tip of their tongue is mRNA, and the fact that it's not been used in the past. I find that interesting that everyone goes on Facebook and all of a sudden they get their pharmacy degree or the medical degree or the virology degree or whatever, and they become experts. But is there a difference? Can you tell the difference in receiving this vaccine versus, say, a shingle shot?
I mean, for how it works, I don't think you're going to see much of a difference. There are, of course, the side effects to any vaccine. And I think the side effects for the COVID one are what's scaring people. They feel like they're going to feel really bad for a long period of time or catch COVID, but they're not going to. They may feel bad for a day or so, but I really haven't heard anybody saying the side effects have lasted more than like 24 hours. So
I received a Moderna vaccine, and my second shot, I just felt a little tired, I guess. Fell asleep in my easy chair. When I woke up the next morning, it was all gone. And I want to tell you that 8 hours to 12 hours of feeling tired or worn out was a little price to pay to know that I am protected now from the effects of COVID. And lots of people would tell you that young people don't seem to have that effect, or it's only older people. Well, I know a lot of young people who have, and I've had a couple on this program who had COVID, and it affected them terribly. And after 3 months, they're still seeing those effects. I had a good friend of mine who he and his wife had COVID, and here we are almost 6 months later, and they're still on oxygen. So the after effect, the long haul effect, really is getting to people. Ron, the folks I hear all the time out there that this really isn't a vaccine because they're using messenger RNA, and it's not like the old vaccines where we use dead viruses or attenuated viruses to get the effect. But in reality, those old vaccines gave us the same effect that mRNA is doing. mRNA, I think, is just telling your cell to create a little snippet of virus shell that can be recognized, and then your body is going to produce antibodies that attack that destroy it. So I don't understand. Can you understand, or do you understand where they're coming from when they say things like that?
Well, unfortunately, like you just said, you know, I've experienced that very same thing when I was trying to post useful and helpful information on Facebook, and I got blasted for it. And matter of fact, even so much that last year I was president of the board of pharmacy, and I actually had 2 people complain to the board of pharmacy. Just all I was doing was trying to put out helpful information. So it is aggravating that you have people that are not health experts that are spreading rumors or saying bad things about it. But mRNA technology is the wave of the future. And, you know, if you've seen any of the specials that's been on about Pfizer and Moderna, how they developed this, and the lead scientist in getting this done, you know, this really was a feat, of a scientific feat to get this done in such a speedy manner. And, you know, it's going to be, the good thing is the way this is made. You did have some food allergy people that could never take a regular vaccine, and now with the mRNA they can. So to me, there's going to be a whole lot more benefits than we had before in looking at the old technology. And of course, you know, some of them that are still made with the old technology are still going to be as effective, but it does help benefit everybody in how quickly this came out, which is truly miraculous in my book. But I just would encourage every single person, please call one of us on this virtual meeting today, or call a healthcare professional, and quit listening to people that's, you know, just picking up stuff on the internet or Facebook about, you know, one of the rumors was you're going to get HIV from getting this vaccine. There's no truth to that.
Oh,
So,
it's going to change your DNA. Remember that one. That's
Oh,
the
yeah.
best one, when we
Yeah.
know that mRNA does not get into the cell core, the nucleus of the cell at all, where the things that make you and Carl and Martika, themselves, it doesn't go there. It doesn't affect that. So
Right.
yeah, and I understand the personal attacks. Anybody that said anything that was contrary to the personal belief of some of the anti-vaxxers, I guess I would call them, or some of the conspiracy COVID folks, you were going to get blasted, and it was just, well, anyway. You're entitled, I've always said you're entitled to your own opinion, but you're not entitled to your facts, and we can back up the facts regarding this vaccine. So Carl, tell me, what did you have to do to get ready to be able to distribute this vaccine? We read how you have to have things that would freeze it down to what, -60 for the, I think it was the Moderna, and the Pfizer was a regular freezer was going to do it. And my understanding that the Johnson and Johnson, just a refrigerator will do it. So did you guys have to do anything special to prepare to handle it?
Well, actually, we are set up with the federal government program. So after some extensive paperwork and credentialing, we started receiving our doses in February, and we are receiving the Moderna brand. Mm-hmm. And it comes in its own little refrigerator pack, and it is transferred immediately into the refrigerator. There's a lot of regulations as soon as we take a vial out, and it is good for 6 hours. So we have 10 doses in that vial that we have to account for. So unlike the flu vaccine, this one we do have to do a little prep work. We have to make sure we have 10 people signed up, because the last thing we want to do is waste any doses. I'm happy to say that up to this point, we have not wasted a single dose. There's too many people that need it and want it. We have people on standby that will come in on a minute's notice if there is somebody that has to cancel at the last minute for whatever reason. But ours is actually, when it arrives in the pharmacy, you do some temperature checks that are provided in the actual box. And as long as those still are within range, you immediately transfer it to your refrigerator in the pharmacy. And we do temperature checks daily on that.
Okay. So I'm going to guess were you set up with the program that was vaccinating our nursing home residents and those folks?
Well, actually, the state signed people up and contracted with other individuals. That yes. we actually got set up with the federal government program to start administering. So we did not go into the nursing homes, but okay. We've been administering here and homebound.
Now, Martika, I know Danhauer is not far from the courthouse, and I know a couple of our employees that walked across the street got the one shot. So you guys have been using Johnson and Johnson. Have you had any issues with storing, receiving, distributing, anything like that?
I mean, the Johnson & Johnson is probably one of the easier ones to store because it is good in the refrigerator. Again, like the Moderna and the Pfizer, once we open that vial, the Johnson & Johnson has 5 doses in it, and we have to use those 5 doses within 6 hours. I will say the Johnson & Johnson, still the supply of that is limited because they just got approval not too long ago. So we're not getting a whole lot of doses of Johnson & Johnson at the time from the state. Just because they're not making as much as like Pfizer or Moderna have been able to right now. So we've also had some Pfizer doses as well. Those are a little more strict with storage because those are the ones that originally had to be stored ultra frozen. Now the CDC says they can be kept in a regular freezer for up to 2 weeks. So my understanding on the Johnson & Johnson was they had a limited amount that I think Moderna and Pfizer, while they were getting FDA approval, they continued to manufacture, and they had a pretty good stockpile, where Johnson & Johnson did not do that. Ron, you guys, do you use predominantly Moderna or Pfizer or what?
Right now, we're predominantly Pfizer. We've got an ultra low freezer that we borrowed from Bard Distillery in Graham, Kentucky. And so it makes it very nice when it comes in. It has its own little monitor to make sure that nothing in the cold chain of tracking it, everything's fine. We put it in our ultra freezer, and it's really given us a lot of relief that we don't have, because it'll stay in that particular state in safety, in the safe zone, minus 80 degrees Celsius for 3 months. And then so when we take it out and put it in regular freezer at our stores, it's good for 2 weeks. And then we've also had Janssen ever since February, and of course the first rollout was just 100 per store on the average from the state program. And then recently on the federal program, I got 300 that should be coming in tomorrow, and hopefully even next week that's supposed to go up. Okay. So and the biggest, you can compare the three. Obviously the Pfizer is 95% effective. Moderna is 94.1% effective, and the Johnson & Johnson is 72% effective. And of course, those vary depending on the genre, depending on the age group. But then you look at the Johnson & Johnson, it's a one-shot deal. So a lot of people have elected to go that route. Plus, it's supposed to have half the side effects of Moderna and Pfizer. So you can make an argument for any of them, but the biggest thing is, like Dr. Fauci said, and I just keep telling everybody, which one should you prefer? The one that you have an opportunity to get. So that's the main thing. Is we've got a lot of people on the waiting list for the Janssen one, and now since we have plenty of the Pfizer, they're going ahead and getting because in 3 weeks they'll have their 2 shots in, and there's no guarantee about the number of the Johnson & Johnson ones will be in. So
and that segues into kind of a statement I was going to make. So what I hear you saying, all of you, as you were shaking your heads, if you have an opportunity, doesn't matter which one you can get, take the one that you can get. That's number one. And I read somewhere, and you can confirm or tell me I'm all full of beans, that all of them are 100% effective in keeping people out of the hospital and keeping people from dying, which is the big issue.
And Judge, the preliminary information came out today, which is awesome news, that Pfizer's been studying 12 to 15-year-olds, and it's 100% effective in the preliminary data that's coming out. So they think before this year's school or next year's school year starts, that's going to be a godsend for that too. So
right. Real quickly, we've had a question from someone, and it concerns. Let's say somebody makes an appointment and they fail to keep the appointment. You've got to use the vaccine. You've opened a vial. Can people sign up to be on standby to receive those that are not? Do you, all three of the stores? I see you shaking your head. So I would assume that Nation's Medicine, you can do that. Danhauer's, you can do that. And Poole's, you can do that. You can sign up to be on standby. What are the qualifications or requirements to be on standby?
We actually encourage people to call the store, Judge, because we have a website, nations54.com, that you can go to and sign up. But because of what you just said, extra doses or people that are not able to keep their appointment, we encourage people to call us, because we like to have a running waiting list that we can have people come in at the drop of a hat. And that way we keep both going at the same time. We keep people scheduled online, and we also have that waiting list. And I'm sure Ron and Martika and them do the same thing or very similar things, but we just don't want any of it to go to waste. If you get it, you want to make sure you use every dose possible.
I'm assuming, Shake. Yes, sir. Go ahead, Ron.
Judge, the thing that I like, Dr. Stack, who's the head of the Kentucky Department of Health, he's been so supportive of this practice because, you know, somebody could say, well, if you're not giving it to a qualified individual, then you don't need to be doing that. No,
Right.
he doesn't want any wasted doses, and neither do any of us. So he said, we're not the COVID police. So when we have those waiting list people, we may have a healthy 21-year-old, but you know what? We're not wasting a dose. We're getting it in them. We're getting them scheduled. They appreciate it. We appreciate it. So that's the big benefit. And it's a must, like Carl was saying, you know, we have those down there. And then the good news is, unless the governor's changed anything, by April 12th, it's going to be wide open eligibility.
Right.
So we're only a few days, less than 2 weeks away from that.
Back early on, I heard a lot of folks complaining, well, in such and such counties, somebody got it and they weren't 70 or older, or they weren't 60, or they weren't essential workers. In my opinion, you guys were doing exactly what you were supposed to be doing, making sure that the vaccine got into somebody's arm. And I don't care if it's a 21-year-old, a 25, or a 30-year-old, that's one less person when we get them fully vaccinated that will be able to take that disease and spread it around the community. So to me, that's a good thing. I'm sure early on it was hard to get the vaccine, Martika. Have you gotten a pretty steady supply? Is it reliable, I guess is what I'm asking, from week to week? Or how do you know how many vaccines you're going to get? Is the state or the feds, are they in contact with you and telling you ahead of time so that you'll know what you've got to put out?
Yeah, the process is changing, but through our federal partners specifically, we're having a pretty steady supply. I can tell them how many doses I'm available to take. Like I said, I'm mostly getting Pfizer from them. Now, when it comes to Johnson & Johnson, they haven't, like you said, ramped up their supply. So, I wasn't expecting any last week, and then all of a sudden I got an email from the state saying, hey, you're getting a shipment.
Yeah.
So we were excited about it, but, those are harder to plan, and we just have to go on our, just keep our wait list.
Right. And I would suggest that probably just like Carl said, you got a Facebook page, people can go there, they can get all the information about the availability, they can sign up, they can do all those kinds of things. Right now, I'm trying to remember, is it 50 here in the state of Kentucky? It's 50 and older are eligible. So that means that if you were 70 and failed to get it when you first became eligible, 50 and older, you fall in there. There are essential workers, a list of essential workers. I think, as I heard you say, even if you don't fit that criteria, sign up on the standby, right? Sign up on the standby, because the goal is to get it into the arm. And I believe you're right. I have not seen, unfortunately, had some personal time I had to take right before this and missed the governor's, every 2 weeks he meets with local mayors and judge executives. But so far I've seen no change. And I believe the second week, next week, is it next week or the 12th? I can't remember. 12th, everyone above the age of 16 will be eligible. So,
Judge Al?
yes.
Actually, now the CDC, when you go on their website on March 29th, just a couple of days ago, the vaccine eligibility phase included age 40 and over.
Okay.
They actually want to prioritize groups 1A and 1B, but as we see more and more of them getting vaccinated, they have lowered it down to 40 and over as of the 29th, just a couple of days ago.
Okay, good.
And don't forget, Judge, that, it's still also 16 and older with medical and behavioral health conditions.
Yes.
That might increase the risk of severe COVID-19 disease.
Right.
Those lists, there's probably about a 25 item list here of diseases that they point out, but that's on the CDC website. People can go to that, or just call any of us on the virtual.
That's why I was going to say, again, if you have any questions, call your local pharmacies. You can go to the CDC website or go to KentuckyCovid19.ky.gov, and you're going to find more information than you ever wanted to know about COVID. So we've already talked about eligibility. We've talked about residents. Is there a fee? Do you guys charge a fee for the vaccine?
We cannot charge anything for the vaccine.
Right now, there is a possibility. Yes, go ahead, Ron.
We can bill for the administration fee, and that is all. It is illegal.
Right.
It's illegal for anybody to be charged a fee.
Right.
For
Will most people's insurance, if they have insurance, does that pay for the administration fee?
Yep.
Yes, sir. And even if they don't have insurance,
Mhm.
that's not a problem, because the government has supplied an administrative fee clearinghouse that we can even submit a cash claim to. So there is no excuse to not get the vaccine if you want it.
I started to say, knowing you three guys, your pharmacies, if somebody showed up and didn't have the money to pay the fee, you're going to give them the vaccine.
Yes.
That's the goal in the healthcare. I mean, it's not about the money; it's about our people.
Yeah.
There's a question about side effects from the vaccine. I think we've talked about those already. What would you say, or how would you encourage, or would you encourage, and I know the answer, those who are still weighing their options, whether to get the vaccine or not get the vaccine? What say all three of you? Would you encourage them? Yes.
I'll go first.
All right.
I do encourage everyone, and I agree with Ron and Martika. And I think as pharmacists in this community, we want our community well. And I think it has to be an individual decision. And I think everybody comes to it at different times. And we even have some people that sign up for the shot and still come in with some questions right before they get the vaccine. And that's perfectly okay. That's good. That's what we're here for. And that's why we're in the community. But I do feel like it's important. This is a virus. This is real. It's not going away. So we do need to vaccinate ourselves and try to protect our community as best we can.
The bottom line is we're in a pandemic, and let's hope that this is the only one we have to deal with in our lifetime. So we've got to do everything we can, encourage people. The toughest population of people on this decision is your childbearing age women. The statistics just aren't there. The studies are just not there. Out of the 43,000 people that took place with the initial Moderna study, one of the prerequisites was to not be pregnant. They did have some, however, get pregnant during the study. They have tried, they're trying to pull the information together on that. But that's the toughest age right now. And of course, I encourage everybody of that age group to please talk to your OBGYNs and make that decision together, because that's the expertise that you need to go to make that final decision.
In your comment regarding, let's hope we never see another pandemic, my dad was born in 1919. He had a baby sister born in 1918, and she died during the pandemic. His mother died later in the early 20s, 21 or 22, when the pandemic was still around. So we have folks who are living today who have had their families directly impacted. We have folks today and young people born today who will see their families directly impacted by this pandemic. So it's one of those things, and I've talked about it before. I don't wear the mask really to protect me, although I know it'll protect me. I'm actually wearing it to protect my fellow man. I'm doing all those other things. And when I get vaccinated, the vaccination is going to protect me, but it's also going to protect my fellow man because I won't be a carrier. So I guess last question, tell me why it was important that our local pharmacies be included in the distribution network. Martika, why don't you start?
I think it goes back to what Ron was talking about of how effective pharmacists have been at increasing vaccination rates. We are close with our patients. We know who they are. We like to take care of them. And, we're going to be able to get out there. Like I said, we're able to travel, go places, hold these clinics, and really reach the population and get the vaccination done.
Well, for me, I think the importance is this, that Nations Medicine and Danhauer Drug and Poole's Pharmacy are well-known names that have been in this community for years and years, and people trust you. And they know that you live in this community, you know, you have the health and welfare of the community at heart. And to me, that's probably the biggest reason, is that you like to do business with people you know, and you guys are well known. So normally I'm going to go around and let you each say anything that you would like to say. If this thing goes down, it's because my battery is running low. But I'll go in reverse order, and ladies first. Martika, anything you want to say?
I appreciate the time to update the community, and like we're here for you all to answer your questions and protect you from this virus, hopefully.
Okay, Ron?
Well, I just appreciate the opportunity to be on the call with you today, and especially even with my fellow pharmacist on here. You know, we're all trying to do our part in getting one step closer each and every day, and one step closer with each and every vaccination to maybe get to a new normal of life sometime. So I know that all of us are there for our people to ask questions. We want them to feel comfortable, and you know, being we are the most successful healthcare entity out there. You know, people average coming to our to see their pharmacist 13 to 14 times a year versus 2 to 3 times their physician. The reason why it was kind of a struggle early on, and we all wanted to get a hold of the vaccine, is because we're used to being a primary part of vaccinations. And whenever, you know, we already had our workflow down and ready to go and ready to vaccinate, and they were putting new teams together all over the place and opening these things up. So to us, it just didn't make a lot of sense. But I think it wasn't about an anger thing. It was just about, you know, we want to roll up our sleeves and get in there and do what we know we can do, and that's vaccinate people.
Okay, Carl?
Well, I just want to thank you for the opportunity to be on here. And again, reiterate what Ron and Martika have said. We love this community. We love the people. That's why we're doing what we're doing day in and day out, early morning to late at night. We have to get our community well again and get past this pandemic. And we're willing to do what it takes.
Folks, just another example of your local pharmacies taking care of the health and welfare of our community. If you need a vaccine, you're welcome to go to their webpage. You're welcome to give them a call if you need help signing up. And I want to remind everybody that there's no reason for you not to get out and get the vaccine, because we also have free transportation to and from a vaccine site being provided by Grits Transportation. All they need is a 24-hour heads up, and they will make sure that you get there. Guys, thanks for being on here with me today. I think we got a lot of information out, and being that you are local folks, used to dealing with local folks, you bring a lot of credibility to the vaccine program. So thank you again.
Thank you.
Thank you, Judge.
Thank you all.